Healthcare is one of the most complex issues that we deal with as a society. And it's difficult because it is very, very costly. We have tremendous needs within our society, there are many, many players involved in this. The issue of healthcare will always be difficult because we have a shrinking budget continually in healthcare. We have increasing needs every year. We have increasing needs because of growth of technology, growth of certain segments of our society which need health care, and we have a shrinking workforce. We really can't deliver health care now in an effective manner with the number of people we have in the system, and it looks like it will only get less over time. So in order to pull together all of these different players and put them into an integrated system which delivers cost-effective, high-quality health care to the most people possible, requires constant negotiation with them. You can't ask people to always give something to make the system better. They have to get something back. So we have to constantly go through the negotiation. What can I give to you that will make you work with me better, that we can deliver more effective health care to the entire population?
In the Renegotiating Health Care book, we identify a number of key factors that are causing that change. Changing in the financing and in the organization of the system, changes in technology to serve people, changes in the workforce, and a changing patient. People today have a lot more information when they come into the healthcare system about their health. They have many more questions of people who are working in the system. And so with all of those changes, those old relationships need to be renegotiated. How we negotiate the changes, whether in an adversarial way or in an interest-based manner, will make a very big difference on what we're able to achieve. So the key theme of renegotiating healthcare is recognizing what those changes are, being able to address them and negotiate through them with interest-based negotiation, and therefore, as a result, come out with conclusions on the other side that are more satisfied, mutually beneficial to all involved.
When you look at the last generation or two of people who've come through the healthcare system, treatment has evolved rather quickly. We are getting much better at how we treat diseases. What's either remained stable or changed much more slowly are the other relationships in the system. So what you expect when you walk into a doctor's office or what you expect when you walk into a hospital, they didn't change very much. That is now all up for grabs because we've got an aging population that's demanding more services. We have more treatment options that are getting expensive. We have less money, lower reimbursement rates, a lot of pressure on the system from a lot of directions. That means no one can take for granted anything anymore. Doctors, nurses, administrators, patients, policymakers, they're all having to rethink how they address healthcare, how we try and deliver the highest quality care to the greatest number of people at a cost we can afford. That means there's a lot of negotiation going on. Some is explicit, some is implicit, but everything is being renegotiated right now. So if you're a player in that system, you need to know how to negotiate. You need to know what the outcome is you desire and how best to bring along the other people so that you can get what you need and they can get what they need.
Well, Renegotiating Healthcare is a book which is designed really for a very broad audience. People who are in policy-making decisions, people who have to deliver the health care, people who have to modify the system to make it more efficient, all need to know what the other people are thinking. The book allows people to put together the different players within the system, ask what can they give to make the system better, how can we augment all the things that are available to leverage the capacity of the system. It allows people to look at what is happening, what they have to offer, what they need to get to make their job more efficient, and what they can afford to give to the system to make it a more cost-effective quality system.
We're making decisions about our healthcare system now that we're going to be living with over the next decade, if not longer, and especially with a growing population of people in their senior years who are going to be calling upon the healthcare system even more, and who no doubt will be living longer. The decisions that we're making right now about the financing, the organization, the relationships that people have with the healthcare system, critically important. We believe that people who are working in the system have to have tools for negotiation to help them in crafting the best possible work conditions and system that we can achieve as a country. Many times, especially for people who are clinicians, negotiation and conflict resolution is not a skill that they learned in school. So for many, this is an opportunity for them to build that set of skills into their professional repertoire. The first edition and the second edition of Renegotiating Health Care were published in very, very different periods. Now, the capacity for the use of technology in affecting what we do in the healthcare system is critically different than it was before. Many hospitals now are adopting electronic medical records. Our capacity to know and understand our DNA and eventually to get to personalized medicine, very, very different. The population is more educated and more aware of their own health and health needs because of the internet. So that all of those relationships that are critical to what happens in the healthcare system are truly being renegotiated. And we're hoping that the book will provide a guide and a manual and direction for how to best engage in those negotiations in order to get the best possible outcome from those negotiations.
One of the things that was interesting as we researched the second edition of this book and did a lot of interviewing in the field was, first of all, there are a lot of great ideas. There are a lot of smart people who have thought very hard about how to address some of the challenges in the system. Also, the conversation that we most often hear in the news in Washington is very much thinking of this as a linear system. If only we could do tort reform. If only we could cap payments to doctors. If only we could ... everything would be fine. In reality, this is a complex system. And that means that there are a multiplicity of factors that need to be addressed simultaneously. And each time you try and pull one lever, it affects everything else. That means that the negotiation is very complex, and you need to do what we think of as whole image negotiation or multi-party negotiations. You need to be able to align people's interests to try and find an outcome that is good for all and negotiate in that direction. We've tried to provide both a conceptual framework as well as some really practical tools that people can put to work to help bring that about.
Just as we're learning more about healthcare and we can do clinically more in our healthcare system than we could even just a few years ago, we're also learning that the system itself, the way we organize services, the way we relate to one another and engage with one another is evolving as well. So the key point of the book is that as we go through that evolution, through those changes, and in some cases transformation of the system, we need to have the skills and capacities for effective, efficient negotiation. And so what we're talking about in the book in terms of walk in the woods, meta leadership, conflict resolution are all key skills and practices that will facilitate this critical evolution of our healthcare system.
Renegotiating healthcare can be a tool for people that are thinking about how do we renegotiate the entire system, how do we remodel the system, how do we redeliver the healthcare that we have to the population that we need to address. It looks at the many issues that healthcare is facing today. It looks at the fact that we have a very aging population. We have diminished money within the system. We've increased technology on an ever-increasing growth rate, and we also have a diminished number of caregivers within the system. The number of doctors are diminishing, the number of nurses are diminishing, and we need more and more care extenders or physician extenders within the system. The book allows us to look at all the problems in healthcare and say, what are the nuances where we could change things to make things fit better? What you're trying to do always is to create a better fit within the system. If you're going to deliver healthcare to the most people possible in the most cost-effective way possible, we really have to leverage all the resources we can. No one entity can do this alone. The doctors can't do it, the government can't do it, the insurance companies can't do it. And if they work in tandem with one another, there's a good shot at it. If they work in conflict with one another, probably it will never happen. So the book is a guide for these people, and hopefully will be used by them to deliver for our people a much more effective healthcare system.
Thinking about the policy debate in Washington, I think the first thing that needs to be done is to begin to approach it in a more collaborative way than in a confrontational way. When you think about fixing or trying to bring about a complex system that can deliver high-quality health care for as many people as possible at a reasonable cost, that requires everyone to sort of get together, put their heads together, and work toward a common solution. When you look at how legislation is put together, That's often a lot of give and take, swapping, carving up little pieces for different people to get their votes. It's exactly the opposite way you actually go about trying to put a complex system into alignment. When you think back to how the Affordable Care Act was put together, that's how you have to do legislation, but it's not how you put together a great healthcare system.
Have a shrinking budget continually in healthcare. We have increasing needs every year. We have increasing needs because of growth of technology, growth of certain segments of our society which need healthcare, and we have a shrinking workforce. We really can't deliver healthcare now in an effective manner with the number of people we have in this as a society. And it's difficult because it is very, very costly. We have tremendous needs within our society. There are many, many players involved in this. The issue of healthcare will always be difficult because healthcare is one of the most complex issues that we deal with. You can't ask people to always give something to make the system better. They have to get something back. So we have to constantly go through the negotiation. What can I give to you that will make you work with me better, that we can deliver more effective healthcare to the entire population?
In the Renegotiating Health Care book, we identify
system, and it looks like it will only get less over time. So in order to pull together all of these different players, and put them into an integrated system which delivers cost-effective, high-quality health care to the most people possible, requires constant negotiation with them.